Well, if you get hurt at work, your injury could end up leading to lifelong issues and lower productivity.
And for some people, industrial rehabilitation can be a good option, but a lot of people who need it don't get it. Today, SSM Health occupational therapist Christa Hoyt is here with us. Thank you so much for being here.
Thank you for having me.
So what is the difference between occupational therapy and industrial therapy? Many of us probably haven't heard of this.
So occupational therapy is treatment to improve people's ability to perform daily functions. Those are daily functions at home, at work, at school. Industrial therapy is a specialty within occupational therapy, so we really focus on the injured worker, and the focus is to return them to their pre-injury work level. And this includes, looking at their job demands, figuring out what deficits they have, and then developing a plan to get them back to work.
Specific to their work.
Specific to their work. So like if you're someone that delivers feed bags for a living, and you've injured your shoulder, you need to be able to lift 50 pounds repeatedly. How are we going to get you there? Because when you're on work comp, you get paid usually 60% of your base pay, and so those individuals are quite anxious to get back to work so they can provide for their families.
Absolutely. You mentioned maybe someone who's lifting something heavy at work. Are there other types of workers who you see frequently who might need this type of therapy?
There are many. We have healthcare workers such as myself, nurses, we have x-ray technicians, lab technicians, we even have some physicians, especially surgeons, that are
very important.
In the surgery, getting hurt from those sustained positions. We have those that work civilly for firefighters, police officers, post office workers. We have the tradespeople. We see a lot of carpenters, plumbers, electricians, pipe fitters, agricultural mechanics. And then we have, our laborers, our factory workers, our warehouse workers who do a lot of lifting, a lot of repetitive tasks around machines that can unfortunately cause harm if they're not operated safely. So it is such a wide variety. We get a lot of different injured workers.
Okay, so a lot of different types of jobs and a lot of different types of injuries. Why do some people who need it not get it?
I think part of it is just awareness that is out there. You go into physical or occupational therapy depending on your injury, but then when your pain levels are coming down and you're starting to increase strength, that doesn't mean, voila, now I can lift 50 pounds repeatedly all day long. You have to build yourself back up, especially if you've had some kind of injury that's kept you out of work for 6 months. Things have changed in your life, and you need to build up that strength and endurance so that you can return to work safely. We don't, as medical professionals, want to return you to work and then have you come back off work because you weren't ready. That doesn't help you at all.
Right, we just have a few seconds left, but what is the first step to getting started now that people know about this?
Really talk to your physicians and talk to your physical and occupational therapists and let them know that I'm feeling ready to address some more of my work-related tasks. And they'll know where to send you.
Well, it's good to know. Thank you so much for being here and sharing.
Thank you very much.
Yes.